Bruises, also known as contusions, are discolorations and injuries that appear on the skin when blood vessels beneath the skin rupture or break due to some kind of trauma or impact. They are a common occurrence and can happen to anyone. When a bruise occurs, blood leaks out of the damaged blood vessels and collects under the skin, causing the characteristic discoloration. Initially, a bruise may appear red or purplish due to the presence of oxygenated blood. Over time, the color may change to blue, green, yellow, or brown as the body begins to break down and reabsorb the blood. Bruises are usually accompanied by tenderness, pain, and swelling in the affected area. The severity of a bruise can vary depending on the force of the impact. Minor bruises typically heal on their own within a couple of weeks, while more severe bruises may take longer to heal. The main symptom of a bruise is a visible discoloration of the skin in the affected area. However, bruises are usually accompanied by other symptoms as well. These can include pain or tenderness. Bruises are often sensitive to touch and can cause discomfort or pain. Swelling. The area around the bruise may become swollen due to inflammation caused by the injury. Skin warmth. The skin over the bruise may feel warmer than the surrounding skin. Stiffness or limited range of motion. Depending on the location and severity of the bruise, movement in the affected area may be restricted or uncomfortable. Discoloration. Initially, a bruise may appear red, purple, or blue due to the pooling of blood beneath the skin. As the bruise heals, the color may change to green, yellow, or brown. Gradual fading. Over time, the bruise will fade and eventually disappear as the body reabsorbs the trapped blood. Possible accompanying injuries. In some cases, bruises may be accompanied by other injuries, such as cuts, scrapes, or fractures, especially if the impact was significant. Bruises are typically caused by trauma or injury to the body. The most common causes of bruises include impact or trauma. A direct blow or injury to the body, such as a bump, fall, or collision with an object, can cause blood vessels to rupture and result in a bruise. Accidental injuries. Accidents, such as sports-related injuries, car accidents, or household mishaps, can lead to bruises. Falls. Falling, whether from a height or on a flat surface, can cause bruises upon impact with the ground or objects. Sports activities. Participating in contact sports or engaging in physical activities that involve rough play or collisions can result in bruises. Surgical or medical procedures. Certain medical procedures, surgeries, or injections can cause bruising at the site of the procedure or in nearby areas. Medications. Some medications, particularly blood-thinning medications like aspirin or anticoagulants, can increase the likelihood of bruising or make bruises more noticeable. Aging. As people age, their skin becomes thinner and loses some of its protective padding, making it more susceptible to bruising even with minor trauma. Certain medical conditions, such as clotting disorders, platelet disorders, or blood vessel disorders, can make a person more prone to bruising. Additionally, conditions that weaken the blood vessels, like scurvy or fragile blood vessels, as seen in some connective tissue disorders, can increase the risk of bruising. The treatment of a bruise aims to alleviate pain, reduce swelling, promote healing, and minimize the appearance of the bruise. Here are some common methods for treating bruises. Cold compress. Applying a cold compress or ice pack to the bruised area can help reduce swelling and pain. Wrap the ice pack or a bag of frozen vegetables in a thin cloth and apply it to the bruise for 10 to 20 minutes at a time, several times a day, especially in the first 24 to 48 hours after the injury. Elevation. If the bruise is on a limb, keeping the injured area elevated above the heart level can help reduce swelling and promote blood circulation. Rest. It's important to allow the injured area to rest and avoid activities that may worsen the bruise or cause additional injury. Pain relief. Over-the-counter pain relievers such as acetaminophen or ibuprofen can help manage pain and discomfort associated with a bruise. follow the instructions and dosages recommended on the packaging, or consult a healthcare professional for appropriate guidance. Compression. Applying gentle compression with an elastic bandage or wrap can help reduce swelling and provide support to the injured area. Ensure that the compression is not too tight, as it may restrict blood flow. Heat therapy. After 48 hours after the initial 48 hours, applying warm compresses or taking warm baths can help increase blood circulation and promote the healing process. Arnica or topical creams. Some people find relief by using topical creams or gels containing arnica or other ingredients that claim to reduce bruising. However, scientific evidence regarding their effectiveness is limited, so it's advisable to consult a healthcare professional before using them. Protect the bruised area. To prevent further injury and aid healing, protect the bruised area by avoiding unnecessary pressure, friction, or additional trauma.